Like any other medication, it's important to take it as directed. But especially with HIV medications, the problem is that if patients don't take it every day like they're supposed to, what happens is it becomes less effective over time, and they lose options for HIV medications. So it's especially important for patients that have to be on HIV medications to take it every day as directed. The other important piece with HIV medications is that they can cause some serious side effects. So one of the services we provide is to have patients come to us to discuss some potential side effects. If patients don't know what could happen to them, they won't look out for it, they won't be aware of it, they won't know what to do, or they won't know how to self-manage side effects when it occurs. Some of the side effects are they're not serious, they are to be expected. They can be self-managed, and other side effects require that they come in to see a member of the pharmacy team or their primary care provider. It is not okay for HIV medications to skip a dose. It is very important, and we can't emphasize it enough, that it is very important to take your HIV medications every single day as directed. It is very important to take your HIV medications every day. Even missing one dose will decrease the effectiveness of the medication in the long run. What happens is you'll be burning out your options as the disease progresses. And even though there are many options nowadays for HIV medications, a lot of them are in combinations. And so if you burn out one medication, you are potentially burning out other combination medications that have that medication in it. It is important to be 90% accurate when taking your HIV medications. And this is especially important because what happens when a patient skips just even one dose of a medication, it becomes less effective in the long run, so it works less.
If you skip doses here and there, the virus figures out a way to kind of get around the medications, and unfortunately then the medications will eventually stop working for you. So unlike some other medications, it's extremely important that you don't miss doses and that you take them every single day. And that's obviously really difficult to do, and that's why we have a team of people here to help you, to try to support you in doing that. But it's really risky if you do miss doses, that the disease could progress and those medicines will no longer work for you, and you have to take a different regimen that may be more complicated than the one you're initially on.
Once we decide about the medicines that fit this individual, what we do here at Neponset is have the patient sit with the clinical pharmacist and have a good bit of time to be able to go over the medicines in detail, understand how to take it, decide on the schedule for taking it that fits his or her lifestyle, and understand better about the side effects so that they can be managed better. And only then, when the patient has a good sense of what this is all about, how to take it, how to deal with side effects, do we then start the medicines.